Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm so pleased to announce the one, the only, Herma Lee.
Thank you.
It's great to have you. I've been looking forward to this for quite some time. You've been on my short list of people that I wanted to talk to.
Wow.
And so here we are. I was actually late coming to our interview because I was walking through your unit over there, Apheresis, which we're going to talk about, but I love walking through there. It's such a wonderful unit.
Yes, it is beautiful.
It's beautiful, and we're going to talk about the care there. But let's start with you. So first of all, I was telling you before we started that every Monday morning at 8 o'clock I see you because you are featured in a video we show all of our new employees.
Yes.
So every Monday you talk about the importance of Albany Med and your journey coming here, and it's one that every week I say, oh, there's Herma, and she's talking to our new employees, so now you get a chance to talk to them as well.
Wonderful.
So let's begin. You've been here almost 20 years.
20 years, more than 20 years. It'll be
Right.
21 years in September.
And always working in
Apheresis.
apheresis.
Yes.
For those that may not be as familiar as you are, obviously, what is apheresis?
Well, the unit is actually apheresis and infusion. We do many types of infusions. Apheresis is a procedure we do for therapeutic changes in a person's disease process. We remove whole blood, split it depending on what the disease is, and then replace whatever they need. Like sickle cell, we'll remove the sickled blood and replace it with non-sickled blood. So.
It really is an amazing unit. I mean, I'm always impressed because there's so many different individuals at different disease states that you treat.
That's right.
So you mentioned sickle, very important, right? To pull out those sickle cells, and obviously that makes the person feel better, reduce pain, helps them with their recovery. Name some of the other types of conditions that you treat in there.
In apheresis, myasthenia gravis.
Right.
Babesiosis.
Right. So tick-borne diseases.
Tick-borne diseases, yeah, we're
Right.
doing our poster on that, our unit poster on that. And other neurological diseases, vasculitis.
Right. And the infusion area is also areas where you're using really new special biologic medications to treat patients as well, correct?
Yes, we are.
And that to me is interesting because you have to constantly be up on the new treatment protocols.
Yes.
This is an area where things are changing quite rapidly.
It is, and we get the reps that come in and educate us, and we give the drug.
And some of these patients you treat multiple times, correct?
It's a family. It's a family unit. That's the part of why I love it so much, because I've seen some patients for the entire time I've been there.
And you develop a relationship with them.
A relationship, absolutely. And that's very special.
Have you treated them over a course of weeks or months, or in some cases even longer than that?
It depends. Weeks, months, years.
Years.
Some patients come once a year for a drug.
They remember you. They probably request your chair, or they
probably
say, let me have Herma.
I've heard that.
Yeah. And in your time there, obviously you've been recognized for your great work, both inside Albany Med as well as outside. And I know, you're someone who is, not one to speak about yourself, but I'm going to make you. So what are some of the different awards that you have and recognitions you have received?
The Daisy Awards here, the nominations, and Patient Hero Awards for safety.
Right.
I won the Capital Region Nurses Times Union Award.
Wonderful.
Top 10 nurses, yeah.
The Daisy Award, those are all special, of course. The Daisy Award to me is very special because those are individuals who are recognized by people that they're caring for.
Correct.
So this is very personal, right? That's
Correct.
someone saying, hey, I really enjoyed that nurse and the way they treated me or my loved one, and I want to recognize them.
Yes, it is very special.
That's very special. You use the word family as well as far as your workforce. We all have our work family.
Yes.
But family for you is also something that, is about Albany Med as well.
It is.
So Walter, your husband,
yes.
We all remember Walter, security officer here, passed a couple years ago.
Yes.
He was a very special man, but he also did some very special things with backpacks. We all remember that, correct?
Yes. He went around and he collected backpacks. People gave him all kind of school supplies.
Right.
Yeah, no one said no to Walter.
No, they did not. They did not.
Yeah.
And that generosity benefited many students in the local school district.
Absolutely.
Is that something that came through the church? Is that where that started?
No, it started with him. He just wanted to give back. He just loves children.
Right.
Yeah, he didn't want to see anyone without.
Yeah. you're giving me perfect segue. So speaking of children, there's someone in your family who also works here at Albany Med, correct?
Yes.
You want to talk about that?
Simone Hughes, yes, she's my daughter. She works in the cath lab on M6.
Right.
And they absolutely love her. I hear so many things from her managers and supervisors. I don't tell her because she'll ask too many questions, but yes, I'm very proud of her.
One of the questions I ask every week at new employee orientation, as I always say, is there anybody in the room who is a second generation or a multi-generational family? And we always have some joining our workforce where their child works here, their parent works here,
That's
or
right.
their spouse or sibling works here. So we love that part of it.
Absolutely.
Very good. All right, so let's talk a little bit more about what it is that you love about your job and the special work that you do there. I assume you have a lot of co-workers that you really enjoy working with
there are about
as well.
20 of us, and we are a family.
Right.
We do things together here, and we also do things outside of Albany Med. We go on vacation together. We go camping together. We go out to dinner. We do bowling. It's just a family. Yeah.
Apheresis is one of those areas, and infusion, where you often help each other out, right, in terms of particular situations. And so I think that unit there, the team has been working together for quite some time. There's a lot of people who've been working there for many, many years.
That's right.
Retention is something we talk a lot about here at Albany Med. Retention is something that is happening on your unit.
Definitely. Once you get there, you fall in love with the patients, with each other. And it doesn't hurt that our manager, Winsley, is awesome. Yeah. So.
Winsley is a wonderful leader, for sure. And I've known her at various roles in the hospital.
Right.
And it's nice for you to recognize that. Of course, Bear works there.
Yes.
I worked with Bear in the emergency department when I was a resident. And
he wanted to be here now, but he was unable to. But
he'll see this video.
Good.
Let's talk about outside of work then. So travel, where do you like to go?
Anywhere.
What's your favorite place you've ever been?
Oh my God, New Zealand.
You've been to New Zealand?
Yes, we went to Australia and New Zealand. I love them both, but New Zealand captured my heart. Yes, for sure.
And did you go with people from work for that trip?
Just my mother.
Just your mother.
Just my mother.
Very good.
Yes.
What's next on the bucket list for travel?
Probably China or Japan for a missions trip to help speaking the children speak English, learn English.
So you go on a mission trip and you help them with language and things.
Yeah,
is that
this particular trip.
And who do you do that through?
Different organizations.
Very good.
Different organizations.
Very good.
Yes. Yeah.
And is that planned, or you still have to put that one in the books?
No, it's planned.
Okay.
It's planned next year.
Well, that's exciting.
Yes,
I look forward to hearing about that.
Thank you.
You also mentioned you love to read. You're a big reader.
I'm a big reader. My favorite book is the Bible, and then there are all the others.
And all the others after that.
Yes.
So I always ask readers, are you a book reader or a Kindle reader?
A book. I have to have a book.
You're one of
I have
those.
to feel it, smell it. I don't do the Kindles. And I have a library in my home. I built a library in my home.
Did you really?
I did.
How many books are in the library?
About 2,000.
2,000 books.
Yes.
And you've read them all?
Not all.
But most?
Most of them, but not all.
Are you one of those people who just buys books and you stack them up and you...
Yes, like it's part of the decor as well.
Okay. Are they all organized by color or by size?
My daughter did it with a catalog system. So you like the old library catalog system.
The Dewey Decimal System?
We took a couple of years and did that. Yeah.
And are you fiction, nonfiction?
I love nonfiction, but I do almost anything.
You read anything?
Yes,
Okay.
almost anything. Yes.
Very good. So if someone was to say to you, Herma, I'm thinking about working at Albany Med, and you would say to them, I hope yes?
Yes.
Why?
Oh, this is a home. It's a home environment. You have so many technologies that are here to help our patients.
Right.
We have excellent awards in safety, and it's full of compassion, and we have specialists and subspecialists. This is a place to go.
Yeah. That's wonderful. I appreciate you saying all of that, and I agree with all of that as well. We're also an academic medical center with learners. So nursing students learning, medical students learning. I assume they come onto your unit. I'm sure there's times when you help with the teaching that happens here as well.
Yeah, I do a lot of the education on the unit,
Right.
and we do get those that come in just to see what we do, because no one really knows what apheresis is.
Right.
So educating them on that is what we do often.
Which is something that really probably doesn't happen in any other hospital in the area.
Right.
In fact, we know that a lot of hospitals in the area, a couple of years ago, shut down their apheresis programs.
That's right. That's right.
And so those patients get transferred here specifically for the skill set that you and your colleagues have.
That's absolutely correct.
Yeah, very good. So what's in the future? So you've been here 20 years. Can we count on 20 more? Or?
I hope so. I'm hoping to broaden my horizon with the Patient and Family Advisory Council.
Are you going to be working on that?
I am with Mary Alice on that. I'm looking forward to some of the things that are hopefully coming in the future.
So let's talk about that quickly, because people may not know what that is. This is a very important initiative. It started with pediatrics. Mary Alice Cullen, of course, being very involved in that. Patient and Family Advisory Council is a group where we ask families in the community who've been in this hospital to help us, inform us, make us better. We take their feedback, whether it be visitation guidelines or waiting lounges or protocols or the ways we do things. And it has been very successful in pediatrics, and we're looking to roll it out in other places.
Right.
So I didn't know you were involved in that.
Yeah,
That's wonderful.
The beginning stages. We're still just communicating. We're just finding what the right niche is right now.
And so there's many patients that you might have treated that might actually sit on or be part of that team with us.
Possible.
Yeah,
very
that'd be
possible.
Wonderful.
Yeah,
that's wonderful. All right, good. Well, listen, we absolutely love having you here.
Thank you.
I'm certain there's going to be a lot of people watching this video who know you,
Yes.
who are proud of you, and are
Thank
excited
you.
to learn about your story. Anything else you'd like to say before we take it off the air?
I'm just glad to be here, and I'm thankful that you thought of me.
Yeah, well, like I said, I've been looking forward to doing this for a while. And we
you.
appreciate you being here. We appreciate your whole family being here. You're a huge part of our Albany Med family.
Thank you.
And I thank you very much.
Thank you.